Hey everybody, welcome to this Medicare educational webinar. So glad that you're able to join me. I'm going to go over the basics of Medicare for you and how different insurance plans work in the Medicare world so that you can have a better understanding of what your decisions might be when you're choosing the type of insurance that you want to go with your Medicare, and then some of the rules that go with that. So let's go ahead and get started. I'm going to share my screen with you so that you can see the presentation. And if you would like this emailed to you, please just let me know. So here we go. All righty. Just one second. All right. So like I said, we're going to be talking about the basics of Medicare. And before I totally dive into that, I just wanted to let you know a little bit about me so that you know who you're hearing from. I've been in the insurance industry since 2013. And when I first became an insurance agent, my manager said, if you want to be successful in this business, get to know Medicare. So that's what I did. I read the Medicare and You book 3 times when I first started, just so I could get a better understanding of how it works. And ever since then, I've just fallen in love with the people and being able to help, ease some of that confusion and navigate the whole process. I am the mother of 3, 2 which I gave birth to and 1 that I gained in my second marriage. And I live in Weld County. And if you ever want to butter me up, I do love dark chocolate. And what you'll see at the bottom of the screen is all the different states that I'm currently licensed in, and more to come, I am sure. But this is the current list. Now, what we're going to be talking about today is a few things. So we're going to be talking about the different parts of Medicare, which can get quite confusing. And then we're going to talk about what Medicare supplements are, what Medicare Advantage plans are, what a prescription drug plan is and how it works, and then some rules of Medicare and penalties to look out for. And then if you have employer coverage and you're turning 65 and you have questions about how Medicare works with employer coverage, we're going to go over that. As well as what some supplemental health plans are and how Medicare and long-term care work together. Now, the numbers that you're going to see in this webinar are for 2021, so it's almost out of date. Medicare will release their 2022 numbers at the end of the year, so I'll revise this webinar for that. But currently what you're going to see is 2021. And every January, that's when Medicare would change any costs that are built into the plan. And I should say the Medicare plan itself, original Medicare. So what we're going to do is go ahead and get started. Original Medicare has 2 parts, and the first part is Part A. Now, this is the part that covers hospital coverage. The way I remember that is an A is shaped like a roof. And so if you're in the roof, if you're admitted to the hospital, then Part A is kicking in. It also works if you're admitted to a skilled nursing facility for recovery care. So it's going to work as an inpatient in the hospital, but then also as an inpatient in a skilled nursing facility. Now, Part A has no premium. And we say that, but you really have paid into it your whole life. So anytime you were working and you saw that Medicare premium coming out of your taxes, or I shouldn't say premium, but the tax deduction for Medicare, that was just what's paying for your Medicare Part A. So when you qualify for Medicare Part A at no cost, you have been paying into it your whole working life. So that's something to keep in mind. And again, like I said, this is for inpatient hospital coverage as well as skilled nursing facilities. It's also going to cover some of the hospice care and then a little bit of home health care. Now, the numbers for inpatient hospital coverage are as follows. So on days 1 through 60, you're going to have to pay a deductible. And the deductible is a per admission deductible. Currently, that is $1,484. And let me back up just a moment. This deductible is if you have no other health insurance. So this is just Medicare all by itself, okay? So Part A, hospital admission, $1,484 is the deductible. That's going to cover the first 60 days that you're in the hospital. Now, if you're still in the hospital on day 61, then day 61 through 90, you're going to start to pay a daily copay. And this daily copay is $371. So for that 30-day span, you have $371 a day. It's pretty unaffordable, I know. Now, after that, this is where it starts to get a little bit tricky. So on day 91, what you'll start to use are called reserve days. And so Medicare says, we're always going to cover you in some form for days 1 through 90. So just like you see on the screen. But once you're in the hospital on day 91, you're going to start to use this lifetime reserve day pool. What they do is they give you 60 days that you can use beyond a 90-day hospital stay. So I hope that makes sense because it gets really confusing. So on day 91, you start to use these reserve days. And as you can see in the numbers, that is a doubled daily copay amount. So now no longer $371 a day, but $742. So let me kind of paint this picture maybe a little bit easier. Let's say you have a 100-day hospital stay. 10 of those 100 days would have been taken from your reserve days, the total of 60. And now for the rest of your life, if you ever stay in the hospital longer than 90 days again, you would have 50 reserve days to pull from. So I hope that makes sense. It gets really confusing because it's really unlike anything we've ever had before. Just shoot me a direct message if that's something that you need some more clarification on. Now, Part A also covers a skilled nursing facility stay. So I always liken this to like a rehab center. I've had clients who've had injuries. My father had an injury, had surgery in the hospital, and then was transitioned to a skilled nursing facility for rehabilitation, his PT and all that fun stuff. Now, in a skilled nursing facility, there's a couple of tricks that you have to make sure you follow these rules. So the first one is, again, on original Medicare as your primary payer, you have to have been an inpatient in the hospital for at least 3 days. So if you are held for observation for 1 day and then admitted for 2 more days, you're going to feel like you've been an inpatient for 3. But on paper, you're coded as outpatient observation and then 2 days of inpatient. So technically you would have to stay a 4th day in the hospital in order for Medicare to pay for your skilled nursing facility stay. You also need to be admitted to the hospital within 30 days of being discharged from the hospital. I'm sorry, I said that wrong. Admitted to the skilled nursing facility within 30 days of being discharged from the hospital. As long as you follow that criteria, then Medicare is going to pay the first 20 days of your skilled nursing facility stay, no cost to you. And then you'll start to pay a daily copay if you're still in the hospital on day 21. I'm sorry, skilled nursing facility on day 21. So if you're still in that skilled nursing facility on day 21, you're going to start to pay a daily copay. Currently, that's $185.50 per day. Now, the skilled nursing facility stay does max out at 100 days. So you will no longer be able to be covered on the Medicare side if you're still in a skilled nursing facility on day 101. They would actually require you to then pay all of the fees associated with that skilled nursing facility stay. Something to know about Medicare: they are designed to cover acute recovery care. And what that means is you are showing signs of improvement and getting better. And I think I might have it. Oh, I don't have a slide for that. So if you're in the hospital and you are tabled as far as your progress goes, and you're only receiving custodial care. So custodial care is help with eating, dressing, going to the bathroom, getting from your bed to the chair, things like that. They're called activities of daily living. If that is the only thing that you're getting in the hospital, Medicare will not pay. So they don't cover what's known as long-term care services or custodial care. So at any time, Medicare can say, okay, you need to go home or you're going to have to pay for this on your own. It doesn't have to be after maxing out the allotted days that you're allowed. It's just based on you're getting better and you're showing signs of improvement. So that's Part A. Part B is the second part of original Medicare, and this is your medical coverage. And I say it's like everything else. It's your day-to-day coverage. So this is going to cover your doctor visits, any outpatient surgeries. If you had a wheelchair, walker, or oxygen, it would cover that durable medical equipment. If you needed to go to the emergency room, or you had an ambulance ride, or if you needed chemo. I mean, this is really the catch-all coverage from Medicare. So to me, it's pretty necessary that you have Part B. Part B does have a monthly premium. And so currently, the average monthly premium is $148.50 a month. If you get Social Security, this will just come right out of your Social Security check every month. You won't even notice it. But this could also be dependent on your income. And so Medicare will take your income from 2 years before starting Medicare. So if you start Medicare in 2021, they're going to look at your modified adjusted gross income from 2019. And that's how they're going to determine what your Medicare premium is. And I do have a chart for that, so I will definitely show you that. There's also an annual deductible for Medicare Part B. So now we're talking about coverage. The first $203 that you incur from services like what you see on the screen, you'd be responsible for that. That's the Medicare Part B deductible. So before Medicare Part B will cover and take over, you're going to have to pay the $203 up front. Again, that number will change in January, most likely. After you meet that deductible, then what Medicare does is they go on an 80-20 split, where Medicare pays about 80% and you pay about 20%. So something to note when you're thinking about all these numbers, Medicare does not put a maximum annual out-of-pocket in play. So you would pay your 20% until your 20% is paid. If you had multiple hospital admissions throughout the year, you would be responsible for that deductible with each hospital admission. So just kind of keep that in mind. This is the chart that you can see for income. So if your income is you filing as an individual, you'll stick with the column on the left. If you file a joint tax return, there's a middle column. And then there's a filed married and separate tax return. So you're married, but you're filing separate tax returns. So what you'll see here is just different income brackets. So let's look at the individual tax return just so I can explain it a little bit. Again, these are modified adjusted gross income. So if you're 88,000 or less, that's where you pay the average $148.50. Then you'll see on the next line that there's a range between 88,000 and 111,000. Go all the way to the right, you'll see the premium is $207.90. So hopefully that makes sense. You can look at the numbers here, take a screenshot so you have it. This is also a chart that's on Medicare.gov's website. So you're welcome to look it up because every year this changes. So in 2022, you'll have numbers for the 2020 modified adjusted gross income. If you need to know what a modified adjusted gross income is, you can Google it and you can find the definition, but it might also be a line item on your tax return as well. So hopefully that's helpful. Also for folks who make a lower income and qualify for Medicaid, then your Medicare Part B premium could be paid for you by Medicaid. So now what we're going to do is talk about Part D, and this is your prescription drug coverage. Now, the prescription drug coverage is basically put in place to have coverage for your prescription drugs. So these are the medications that you go to the pharmacy and pick up or have a mail order pharmacy mail you. These are the ones you take home. It also just helps limit the cost of the medications that you take. So if you take a lot of expensive medications, these plans can help control the cost of that medication for you. These plans are provided by private insurance companies, so not directly from Medicare, but insurance companies who contract with Medicare to provide this coverage. You can get them as a standalone product, so it's just a prescription drug plan, or it could be built inside of a Medicare Advantage plan. And we'll talk about those later. Now, this right here is a really interesting dynamic that we have in Medicare. This is the 2022 outlook, and I figured might as well just throw that one in here since it's new. And I have the information. So what you're going to do is start at the bottom. So the first phase of coverage for a Medicare prescription drug plan is the deductible. Now, in 2022, the highest deductible that a Medicare prescription drug plan can charge is $480. A lot of times these companies will not apply the deductible to tier 1 medications, and sometimes even tier 1 and tier 2. So we have to look at the details of the plan. So basically you meet the deductible. Again, the most any company can charge is $480. Now we're going up to the third line. Once you've met the deductible, then you're going to be what's in the initial coverage phase. And this is the coverage of the plan. So whatever the plan says are its deductible amounts and things like that, that's what this phase is covering. Now, you're in the initial coverage phase until your total prescription drug coverage or total prescription drug cost, reaches $4,430. So this is not just what you've paid in, but it's the total cost of the medication. So once that dollar amount is reached, you enter what's called a coverage gap. The coverage gap means that all your medications now are going to be paid at a 25% copay of the cost of the medication. So if you had a plan where your tier 1 medications were 0 copay and you enter into the coverage gap, you might have to start paying $1.50 or $3 or something like that, because you'll have to pay 25% of the cost of the medication. The coverage gap is going to last until you meet your out-of-pocket threshold of $7,050. So this is not really you spending $7,050. Just kind of want to say that because that can be really confusing. But basically there's a way it's all calculated, and it's your true out-of-pocket, which is like you've spent this, the plan spent this. It's kind of like a total cost. It's an interesting dynamic. But once you've met that true out-of-pocket, then you enter what's called catastrophic coverage, where your medications are covered either at a 5% of the cost or a flat $9.85 for brand name medications and $3.95 for generic medications. Most people who take generic medications, and just a few, won't have to worry about the coverage gap. If you take expensive medications, this could be something that you're facing. And the only way to really know it is to put your medications into an estimator and then figure it out. And I'm happy to help you with that. Now, Medicare has, like I said, Part A and Part B have those out-of-pocket costs that you're responsible for. And so there's really two ways to offset Medicare out-of-pocket costs for most people. Now, some people have retiree benefits, union benefits, a bunch of like some other options, maybe TRICARE for life, things like that. But the majority of people are going to have two options. So if you have retiree benefits, that's going to be a little bit different, but could fall along the same lines. So option one being you have original Medicare as your primary payer. Then you get a Medicare Supplement, also known as a Medigap policy, as your second payer. And then because you need to cover prescription drugs, you get a standalone prescription drug plan. And then option two is a Medicare Advantage plan. So let's start with option one. This is a Medicare Supplement. Medicare Supplements, also known as Medigap policies, they pay second to Medicare. So all those rules we talked about with Medicare Parts A and B, those apply because Medicare has to pay first, and then the Medicare Supplement will come in and pay second. And it's going to pay some or most of the expenses, to be honest with you. Now, on a Medicare Supplement, you wouldn't have to worry about a network per se. You just ask, do you take original Medicare? And if the doctor does, you're good to go. Different plans offer different levels of coverage. So there's different letters, and I'm going to show you a chart of that. And these truly are the caboose to the Medicare engine. So like I was saying, Medicare is the driving force, it's the engine to the train, and the Medicare supplement is the caboose. As long as Medicare is paying claims and approving things to be paid, then the Medicare supplement will come in and pay its portion as well. But if Medicare doesn't pay, then the supplement also will not pay. So Medicare does have to pay first. Most of the time, Medicare is going to pay as long as you're doing things that are medically necessary. But if you do something experimental that Medicare doesn't cover yet, or if you have an elective procedure like a facelift, Medicare is not going to cover that. So you just want to make sure if you are doing anything experimental that Medicare does cover it. Now, also with Medicare supplements, these are guaranteed issue coverage, meaning if you send in an application, they're going to guarantee that it's issued to you at specific times. One of those times is when you first turn 65 and are eligible for Medicare. Another time could be when you join Medicare Part B for the first time. So maybe you were working at age 65 and wanted to stay on your employer group health plan. You can, and you can delay Medicare Part B. So let's say you retire at age 68 and you get Part B at age 68. You're going to have guaranteed issue into a Medicare supplement at that time as well. So that Part B start date. Also, if you have A and B and you're on an employer plan and then you leave the employer plan, you'll still get guaranteed issue even if A and B are already in place. You just have to do it quicker. Now, another way you can get guaranteed issue is if you have a Medicare Advantage plan and you move out of your Medicare Advantage plan's service area, then you have guaranteed issue into a Medicare supplement. So those are some examples. There's a handful of other ones, but this is just a good start for the majority of people. Now, after these plans can and will ask health questions. So after 65 and being on Medicare for 6 months or Medicare Part B, then they can ask health questions. But right at the beginning, when you're first joining, that's when you have that kind of free pass to get any carrier, a preferred rate. They're not going to ask about any health issues. So that's kind of your golden opportunity to get on a Medicare supplement. The premium, so the amount of money that you would pay each month for this plan, is going to be based on your age, your gender, and the zip code you live in. So this premium also increases over time, which is generally on your policy anniversary. So if you join Medicare on November 1, then every November 1, you would see a rate increase from your Medicare supplement insurance provider. Another benefit of Medicare supplements is they do offer nationwide coverage. So if you have a home in Colorado and a home in Florida or in Arizona, you could actually use your Medicare plus Medicare supplement in any state, and you don't have to worry about a network or geography base or anything like that. So it'll cover you across the nation and in any US territory. This is the chart of Medicare supplements. So the way this works is when you look over to the left, you're going to see a lot of the things that we talked about as far as Medicare Part A and B and what they cover. A couple of new things on the very top, you're going to see an additional 365 reserve days. So every Medicare supplement is going to give you additional reserve days in the hospital. Remember, these are the days that you use if you're in the hospital longer than 90 days. All the plans give you an additional year, which I know everybody wants to stay in the hospital for a year and a half, right? So you can do that on your Medicare supplement. Another thing that you'll see that's different on here, or an addition, I should say, from what we talked about before, is the blood transfusion first 3 pints on line 3. So the first 3 pints of a blood transfusion, Medicare won't pay for. Therefore, either your plan pays for it or you. So when you're looking at the chart, you'll see check marks in boxes. Wherever there's no check mark, that means that particular plan does not cover that service. So what we generally look at is Plan G just to get started. So look at the G, and what you'll notice is there's a check mark in pretty much all the boxes except for 2. The first one is the Medicare Part B deductible. We talked about that on the previous slides, and it was $203 for the year. So you meet the $203 deductible. Again, that number changes every January. So whatever Medicare determines the Medicare Part B deductible to be, that would be your responsibility on this plan. It's not generated by the insurance company, it's generated by Medicare. So that's kind of good to know. Once you meet that deductible, what you'll notice is all the other check marks, all the other boxes are checked, right? The only one that's not checked is the out-of-pocket limit. And it's just because you don't really need to put one in there, because all you're paying is the Medicare Part B deductible. So that Medicare Part B deductible is your max out-of-pocket. So hopefully that makes sense. And then you can see how the different plans cover different areas. Now over to the right, you're going to notice that the C and the F, so Charlie and Foxtrot, those two plans are in blue. And that's because if you turn 65 before 2020, these plans are available to you. But if you've turned 65 on or after January 1 of 2020, then those plans are no longer available. So just so you know, that's how this chart reads. Now, the other option we're going to talk about is a Part C plan or Medicare Advantage plans. So take what we just talked about with Medicare supplements and kind of put it in the back of the brain, because now we're switching gears. We're talking about Medicare Advantage plans. Now, these will cover and combine Parts A and B together. These plans come in the form of HMOs, PPOs, PFFS, special needs plans, which is the SNP, and Medicare savings plans. So an HMO is a health maintenance organization, and that is where all of your providers are in network, and they have to be in network in order for the plan to pay. A PPO is a preferred provider organization, and this allows you to go in and out of network as long as the doctor will accept your plan. Now, of course, if you stay in network, your out-of-pocket costs will be lower than if you go out of network. So staying in network is always going to be more cost-effective for you. A lot of these Medicare Advantage plans are going to have a 0 monthly premium. So let me kind of tell you how that works. These plans take over for Medicare. Okay, so what happens is Medicare takes the money that you pay them every month, that $148.50 or whatever adjusted amount it is. They take that money and they redirect it to the insurance provider who is giving you the Medicare Advantage plan. So the Medicare Advantage plan is getting paid on the back end by Medicare, and that's why they can offer 0 premium plans. Hopefully that makes sense, but they basically get a monthly fee from Medicare to cover your healthcare needs. Most of these plans are going to include prescription drug coverage. There are options that don't. For those of you who have retiree prescription drug coverage or maybe VA benefits. And then these Part C plans, Medicare Advantage, are offered by private insurance companies. So all those insurance companies that you know and have heard of and have probably had in the past, most of those are going to write Medicare Advantage plans as well. And they're available in certain states and certain counties. So like, for example, I'm in Colorado, and wherever we have dense populations, that's where we have Medicare Advantage plans. But out in the Tules and kind of like on the edge of the state, there's no Medicare Advantage plan available, because these are powerful when they're powered by number. If there's more people in the plan, then they can have better benefits. And if there's not that many people in the plan, then they can get pretty expensive. So then Medicare supplements are your option. Now, in most cases, you cannot take a prescription drug plan and combine it with a Medicare Advantage plan. So if you picked a Medicare Advantage plan that did not cover prescriptions, and then you wanted to put on a prescription drug plan, you may not be able to do that. There's only certain plans that allow you to do that. So just make sure that you talk to a professional. I'm happy to answer your questions always, but talk to a professional about that before you make any rash decisions and put yourself in a position where you can't have the type of coverage that you need. Now, Medicare Advantage plans also include a network of hospitals and physicians, and we talked about that. Obviously, you want to stay in the network. Now, if you have a PPO plan, I have a tip for you. Rather than asking a doctor if they take the plan, what you want to ask is, are you in network? So a PPO plan, a doctor can take all day long and not be in network. So you could inadvertently be going to an out-of-network provider and just not realizing that you are, because they said they would take the plan, but didn't say they were in network. So that's a language thing that you want to make sure that you're asking the right question. Are you in network? On Medicare Advantage plans, I call these pay-as-you-go plans. So they're going to have copays and deductibles, co-insurances, as you need services. So you only pay when you need a service. So 0 premium in addition to your Medicare Part B deductible, and then you just pay for a doctor visit or a hospital stay, ambulance ride, MRI, CT scan, things like that. You'll pay your portion as needed. Excuse me. Now, these plans also give you maximum annual out-of-pocket limits. So they say, hey, in any calendar year, we're going to limit the amount of money that you would spend if you have major health issues and your out-of-pocket costs keep adding up and adding up and adding up. So a lot like employer group health plans or maybe individual plans you've been on in the past, these plans will limit the amount you spend in a calendar year, which is really great. A lot of these plans also include additional benefits, like you'll get hearing benefits and vision benefits. Some even give dental benefits, wellness services like silver sneakers, things like that. The thing that you want to be aware of is that some of these plans will require you to be in a certain category, not category, but you can look at dentists in a certain group, right? So they might outsource their dental benefit to a third-party organization. And so you have to see a provider in that third-party organization's network. And so it's really important to check that out before jumping into a plan and then realizing that your provider's not in the network. So a lot of standalone dentists may not participate in the plan's dental network. That's the kind of stuff that you want to look at before joining and thinking you have this benefit, but then having to change your provider in order to use it. So now, something to know about both Medicare Advantage and prescription drug plans. These guys have an annual contract. So whether you start in the middle of the year or the beginning of the year, so if you turn 65 in June and you start Medicare in June and you have a prescription drug plan, it's going to go through the end of December. And that's just how they run. They're a calendar year contract. So January 1 through December 31. Every year during the annual election period, you can make changes. So October 15th through December 7th, you can make changes to your prescription drug plan as well as your Medicare Advantage plan. And that new plan will start on January 1. So you just finish out the current plan to the end of the year, and then your new plan starts on January 1. Now, a little side note is the very first time that you're on a Medicare Advantage plan, you actually are given a 12-month trial period. Now, there's a trick to this. Your Part A effective date has to match the start date of the Medicare Advantage plan if you're starting with a Medicare Advantage plan. So if the very first option that you choose is Medicare Advantage, if that lines up with your Medicare Part A effective date, then you have a 12-month trial period. The other way you could have the 12-month trial is if you start with a Medicare Supplement, and then after a few years, you're thinking, well, maybe I could just go on Medicare Advantage. If you switch to Medicare Advantage, you get a 12-month trial period then, as long as it's your first time on Medicare Advantage. And that just means that anytime during that 12-month period, if you decide that Medicare Advantage is not for you, you can actually leave the plan at any time during that first 12 months, go back to original Medicare. You can get on a prescription drug plan, and then you can also get on a Medicare supplement without any health questions. So keep that in mind. If you're kind of not really sure which direction to go, you have a little bit of play when you're choosing the Medicare Advantage plan for the first time. Now, another thing to know is Medicare Part C, so this is Medicare Advantage only, comes with an open enrollment period every year. So if you start January 1 on a Medicare Advantage plan, then you can have a opportunity January 1st through March 31st to make a one-time change to that Medicare Advantage plan. But it's only for people who are on a Medicare Advantage plan on January 1. Now, you also get an open enrollment period when you first get on Medicare. So you have 3 months following your initial election period onto Medicare, you have that chance to make a one-time change. I always tell people I think this is a really great opportunity if you get on a plan and then all of a sudden your doctor says they're not going to take the plan anymore. So it's good to know that you have that, it's kind of like grace, right, to allow you to get a plan that works for you. Now, here's some rules of Medicare. You want to make sure that you sign up for Medicare on time. What I mean by that is you have your initial election period. So if you don't have any other health insurance from an employer, then you can enroll in Medicare as early as the 3 months prior to your 65th birth month, the month you turn 65, and then the 3 months after you turn 65. I recommend that you do it before you turn 65 to avoid any delays. If you enroll the month of or the 3 months after, they will delay your Medicare Part B effective date. And remember, Part B is all your medical insurance. It also means that they would delay any start of additional insurance. So they would backdate Part A to your 65th birth month, the 1st, and then they would delay Part B. It's kind of crazy, but that's how it works. And sometimes it can be delayed 2 to 3 months. So really important that you enroll the first 3 months prior to your 65th birthday. Now, another option could be that you're working and you have an employer group health plan that serves as credible coverage, and you can add Medicare when you're retiring. So when you retire, you can do it before, and that's what I would recommend. So you know you're going to retire in 2 months, you fill out your application for Medicare Part B. That would be the most seamless way to do it, okay? But they do give you some timelines. So when you leave an employer group health plan and you're over 65, you have 63 days to get on a prescription drug plan without getting penalized. Now that's totally different than the amount of time they give you to add Part B. Part B, they give you 8 months. So that does not line up, which can get very confusing for people. So remember, when you leave your employer group health plan, you have 2 months to get on a prescription drug plan and 8 months to get on Medicare Part B. But again, if you delay that 8 months, you won't have any medical coverage. So usually we try to line it up and be the same. You lose employer coverage and then you start Medicare the very next day. One thing you should know also, or another thing you should know, there's a lot you should know, but with Part D for the drug plans, you can have Part D with just Part A. So if you got Part A when you turn 65 and then you retire and you go, oh shoot, I never applied for Part B, you can get Part D, a prescription drug plan, and just add it to your Part A so that you don't get penalized for not having a prescription drug plan. Now, you can also get on Medicare when you're eligible because of disability. So if you're on Social Security disability, on month 25, Medicare starts. So you've been on disability for 2 years, and then Medicare will start automatically. Social Security will enroll you in Medicare. They'll send you your card. And at that point, you can add on the other insurances that go with Medicare. Now, some of the rules, you want to enroll in Parts A and B in order to add any additional health insurance. So in order to have a supplement or a Medicare Advantage plan, you have to have A and B both in place. But like I mentioned before, you only need A or B to have a prescription drug plan. And then just kind of to reiterate, Medicare supplements are guaranteed issue when you first turn 65 or when you start Part B for the first time. That just means they don't ask any health questions. Now, some of the penalties, you heard me mention penalty. This is what I'm talking about. So if you opt out of Medicare Part B and you don't enroll in Part D, and this is when you could or should enroll in it, you will be penalized. So what I mean by could and should is you're 65 and you don't have any other coverage. You don't have any other employer credible coverage. So if you're in that category, then you really do need to apply for B and D in order to avoid penalties. Now, if your employment, if you have health coverage through your employment or your spouse's employment, that could be credible coverage. You just need to check with your HR department to make sure it's credible coverage. But this does not include retiree benefits. So if you have a retiree plan through your employer and then you avoid Part B, you'll still be penalized for not getting on Part B when you join later. So you definitely want to do it when you join. Let me go back to this because I didn't spell out what the penalties are. So for Part B, as in boy, the penalty works like this. Every 12-month period that you forego getting Part B and you don't have any other credible coverage, they're going to add 10% to the monthly premium. So if you avoid it for 1 year, they'll add 10% to your monthly premium, and this will be for the rest of your life. But if you avoid 5 years, they'll add 50%. There's no limit. Even if you waited 15 years and added it, you'd have 150% added to your monthly premium. So it's really important to enroll on time. Part D, the prescription drug plan penalty, is 1% of the national average. So Medicare knows what the national average for a premium is for a prescription drug plan. I'm just going to throw out the number $34. Okay, so let's say it's $34. They are going to take 1% of the current national average. They'll take 1% of that and they'll multiply it by the number of months that you went without coverage. So if it's 6 months, they'll take that 34 cents times 6. As the national average changes, so does the dollar amount of the 1%. It's always 1% of the current national average, but it's always multiplied by the number of months you didn't have coverage. It could be 6 months, it could be 60. Again, no limit. So if you don't get a prescription drug plan in place when you could and should, you'll have this financial penalty that's attached to your monthly premium for the rest of your life. And it really is kind of a bummer when it happens. Now, some other penalties to be aware of is a lot of people will ask if VA coverage counts as credible coverage. And this is a yes/no answer. So it's not credible coverage for Part B, as in boy, but it is credible coverage for Part D, as in prescription drugs. So you can maintain your prescription drugs through the VA, and that will be credible coverage for your prescription drug coverage. I kind of mentioned this before. Does a retiree benefit count as credible coverage? And the answer is no. Only active employer group health plans count as credible coverage. Retiree benefits would actually pay second to Medicare, and therefore they are not credible coverage. If you just go on a retiree benefit and then want to go on a Medicare plan later, you would be penalized on Medicare if you didn't have Part B. So you want to make sure that you get Part B and Part D in credible coverage. Now, what about employer coverage? So if you have employer coverage, the way it works is if your company you work for employs 20 or more people, then the employee plan is going to pay first. It's going to be your primary coverage, and then Medicare would come in and pay second. But if the company you work for has less than 20 employees, then Medicare would be your primary coverage and your employer plan would be secondary. So it's really important if you work for a small company with health benefits that you find out whether or not you need to be on Medicare in order to still have that plan cover you. Some plans, you have to be on Medicare once you turn 65 in order to still use the employer group health plan. So just please ask your benefits person, whoever handles your benefits, make sure that they tell you what you need to do for your specific situation. Now, another thing is Medicare is not required if your employer has 20 or more employees, and if your coverage is considered credible coverage. You don't even have to go on Medicare. So always ask your HR department. They'll let you know if your prescription drug coverage is also known for credible coverage. but you may just be able to stay on your employer group health plan without going on Medicare. However, I always recommend that you compare. So compare what your employer coverage is to Medicare plans available to you. If you have a high deductible health plan through your employer, you could save quite a bit of money by being on Medicare, especially if you're diagnosed with a major illness while you're covered on your employer group health plan. So it could just be a really good way to protect your out-of-pocket spending if you go to Medicare and not necessarily stay on the employer group health plan. So something to definitely compare, and it's worth it. Basically, the answer to this question, do you need Medicare if you're on an employer group health plan? It's really up to you. I personally recommend you get on Part A because it's free. And that way you're kind of already in the system. You have your Medicare number already. When you go to retire later, it just kind of makes things a little bit easier for the whole process. Again, we just want to compare coverage, the deductibles you might be responsible for on the employer group health plan. What are your copays? What's your max out of pocket? All that fun stuff. If you are covering a spouse, you probably need to stay on your employer group health plan and not switch to Medicare unless your employer has a cool option of just covering your spouse. I don't know if they do that though. Most don't. So now the way that Medicare works is Part A is free as long as you've worked in the United States for 40 or more quarters, which is like 10 years. And it's you or your spouse. You can get Medicare under your spouse if you were a stay-at-home mom or stay-at-home dad. So you can still get covered. But Part B has the monthly premium like we talked about before. So a lot of times, like I was saying, people will get Part A because it's free, and then they'll just forego Part B unless Medicare is way better than their employer plan. So just kind of keep that in mind. Now, retiree coverage, we talked about this. If you have a retiree insurance plan, that insurance is from a former employer and Medicare is going to be primary. The retiree coverage will come in and be second. And again, retiree coverage by itself is not considered credible coverage. So you would still be penalized if you stayed on retiree coverage. This includes COBRA. COBRA is not credible coverage. And so if your benefits people say you can have COBRA, it's just like the employer group health plan that you're on now, that does not mean that you won't be penalized, but they make it sound like you won't be penalized because they say it's the same coverage. But unfortunately, it's not going to qualify you for avoiding a penalty later. So make sure if you choose COBRA that you're still getting on Medicare A and B. Okay, so that's Medicare. Now, what I want to talk about next is supplemental health plans. So not supplements, but supplemental health plans. This is not to be confused with the Medicare supplement. This is different. But these are plans that will help you pay out-of-pocket costs if you have a health plan that has copays or deductibles or co-insurance. So these are plans like cancer policies, heart attack and stroke policies, hospital indemnity plans, and then of course there's like dental, vision, and hearing. So one of the things that one of our reps from an insurance company told us once is that if you have a Medicare Advantage plan, the fastest way to reach a max out of pocket is with a cancer diagnosis. We just all know that the treatment that's involved with cancer is really in depth and continuous. And so if you had a cancer policy, this would come in and help you pay all those copays and treatments, everything. You can use it for whatever you want to use it for, but it definitely helps you with your out-of-pocket cost. Same thing with a heart attack or stroke. So that's what these plans are. They're money that's paid directly to you to go towards any bills that you incur with that diagnosis. Now, the supplemental health coverage ones, so like the cancer, the heart attack, stroke, the hospital indemnity plans, you do have to answer health questions for these. There's no enrollment period, so you don't have to enroll from at a specific time, but you do need to be healthy when you apply for these plans, because if you're diagnosed with cancer, you can't then apply for a cancer policy. That probably makes sense, but sometimes people will put off getting supplemental health plans thinking they'll do it later, and then a diagnosis occurs, and then unfortunately you can't do it later. So that's how these plans work, but they're really cool. They're super affordable, and then they give you that money to help pay your out-of-pocket costs. Most of these plans, there's no long-term contract. They're month to month. So as long as you pay your premium, they are going to give you coverage, and that's on the health plans. Now for dental and vision, it's a little bit different. You don't have to answer health questions to qualify for dental and vision. Again, there's no specified enrollment period, but a lot of them will give you a contract. So like if you apply for a dental plan with a very common carrier, then you have an annual contract because they're going to give you all these services and they want to make sure that you're going to stay in the plan for at least a year. So the dental and vision plans will a lot of times come with an annual contract. Okay, so let's talk about long-term care. So long-term care is, we talked about it a little bit at the beginning with Part A. This is custodial care. So this is when you need help performing activities of daily living. And there's a list here: eating, toileting. Transferring is when you need help getting from a chair to a bed, you know, getting from point A to point B. So if you can't do that by yourself and you need help, that's when someone assists you to do that. Maintaining continence, getting dressed, going to take a bath or a shower, or if you're simply diagnosed with a cognitive impairment like Alzheimer's or dementia, these things will trigger a long-term care need. Now, it can be received in your home or in a nursing home, which we're probably all very familiar with that. Medicare is designed for acute recovery care. We talked about this before. It just means you're showing signs of improvement. You're getting better. Medicare does not cover long-term care, which is those custodial care needs, help with activities of daily living. And so what I just want you to take from this is that you just need a plan in place for how you're going to cover any long-term care needs if the need arises. It's a high percentage as far as who needs long-term care. There's quite a few people out there that, you know, will need it or do need it. And so having a plan in place, whether that be, you know, long-term care insurance, your own financial backing, Medicaid, there's different ways that you can cover the costs of long-term care. Just know that Medicare does not cover the costs of long-term care. So this is my contact information. If you have any questions, I am always happy to help. Even if you just have a few questions and you want to run it by me, that's cool. I'm totally happy to do that. A lot of people ask me how I get paid. I get paid from the insurance companies. So you don't need to worry about that. When you call me, you're just going to get a nice little chat and have some questions answered. So I'm happy to help you with that. Like I mentioned before, I'm licensed in a few different states. So if you have friends in other states, I'm happy to help them as well. But please take a snapshot of this screen so you have my contact information. If you'd like to attend webinars or see videos, I have a bunch of things posted, and you can go to my website and see the list of dates and also see links to my educational videos that I have that are much shorter than this one, by the way. But thank you so much for taking the time to watch this. I hope it was helpful. And like I said, I am extremely happy to help you with any needs that you have in the future. So have a wonderful day and enjoy Medicare, you know?